Welcome to this special video course, where we are going to study for your big certification exam together. I understand that this medical registry test feels very hard, but we can pass it with easy steps. We will practice every important topic, so you can feel completely ready when exam day finally arrives here. You have the power to learn this material, and I will support you through this entire journey. Let us build your confidence right now, because your bright future in healthcare management is waiting for you. Section 1 focuses on health data standards, chart structures, and the basic rules for keeping clean medical records. We must look at how doctors document patient care, and how hospitals organize these folders for daily operations. Every health facility uses specific tools, like discharge summaries, history forms, and physical exams to track patient wellness. You will learn about quantitative analysis, which means checking charts to ensure doctors signed every single legal document. Knowing these chart requirements is the first big step, because the exam tests this data heavily every year. Next, we must understand qualitative analysis, which ensures the documentation actually makes sense for the patient's care. We will also study legal health records, which are the official documents a hospital shares during court cases. You need to remember compliance standards, because government agencies check these files to stop bad healthcare fraud. We will look at data governance rules, which help big hospital systems manage information safely across different networks. Mastering these electronic record concepts will help you answer many tricky questions on the actual exam very quickly. Finally, remember that health information management involves both paper records and modern electronic computer systems across the country. We are going to practice 19 realistic questions right now, so you can test your knowledge immediately here. Please subscribe to this channel right now, so you never miss our upcoming study guides and practice sessions. You should also check the description below, where I placed the complete course and the offline app link. Let us begin our first practice quiz together, and see how many answers you can get right now. 1. Can you tell me the main purpose of performing a quantitative analysis review on medical charts? It ensures that all required signatures and reports are present inside the patient chart. Managers look for missing items, complete documents, and proper doctor signatures before closing a file. 2. Which document contains the patient's final status, reason for admission, and summary of care? The discharge summary provides a complete overview of the patient's entire stay at the facility. This specific report helps transfer care to another doctor, and it must be signed quickly. 3. What type of analysis checks the quality and consistency of documentation inside the medical record? Qualitative analysis reviews the medical record to ensure that all documentation is clear and accurate. It verifies that the doctor's notes match the patient's actual diagnosis and treatments during their stay. 4. Who is the legal owner of the physical medical record chart inside a hospital setting? The healthcare organization that created the record owns the actual physical document or electronic file. Patients do not own the actual paper. but they have a right to view their data. 5. What is the official name for the specific data set used in acute care hospitals? The Uniform Hospital Discharge Dataset is the official collection group used for acute care tracking. It standardizes the information collected on every single patient who gets discharged from the facility. 6. Which specific health record standard requires that all entries are dated and timed by doctors? The conditions of participation rules require every medical record entry to show a clear time stamp. This rule comes from the federal government, and it keeps patient records accurate for legal reviews. 7. What is the main definition of a legal health record inside a healthcare organization? It is the official business record created by the facility that can be shared in court. This specific document protects the hospital during lawsuits, and it contains all official patient care information. 8. How long should an adult patient's medical record be kept according to basic federal guidelines? Most facilities keep adult medical records for at least 5 to 10 years after their last visit. State laws might require longer times, so hospitals usually follow the strictest rule available to them. 9. What form must a patient sign before a surgeon can perform a major medical procedure? An informed consent form must be signed by the patient before any major surgery can begin. This document proves the patient understands the risks, benefits, and alternative choices for their medical care. 10. Which type of data content describes the patient's name, address, date of birth, and insurance? Demographic data includes all the personal identification details collected when a patient enters the hospital. This information helps registrars identify the correct person, and it prevents serious chart mixing errors later. 11. What index acts as the master key for locating any patient chart inside a facility? The Master Patient Index is the main database used to find a patient's unique health number. It connects every person to their specific record, and it must never be deleted from computers. 12. What kind of database gathers data about specific diseases like cancer for research purposes? A disease registry collects specialized patient data to help researchers track health trends across the country. These registries help public health officials see if treatments are working well for large groups of people. 13. What do we call a chart entry that is written after the patient has left hospital care? A late entry is documentation added to a record after the standard time frame has already passed. Doctors must clearly label these notes as late, so the timeline of care stays completely honest. 14. Which system organizes medical records by assigning a completely new number for every single hospital visit? The serial numbering system gives the patient a brand new identification number every time they arrive. This method can make charts hard to find, because one person will have multiple files separate. 15. Which numbering method keeps all of a patient's files under one single permanent identification number? The unit numbering system keeps all patient visits filed together under one main identification code number. This is the most popular filing system, because it keeps the entire medical history in one folder. 16. What type of filing system uses color codes and numbers read from right to left side? The terminal digit filing system organizes records by looking at the last few numbers first. It distributes files evenly across the shelves, which prevents crowding in busy health information work areas. 17. What term describes the process of scanning old paper charts into electronic computer storage systems? Document imaging converts physical paper charts into digital files that doctors can view on computer screens. This process saves a lot of physical space, and it allows multiple workers to see charts simultaneously. 18. What is the main purpose of an advance directive form inside a patient's medical file? It states the patient's end-of-life healthcare choices if they become unable to speak later. This legal document guides the medical team, and it protects the patient's wishes during emergency situations. 19. Which group creates the official rules and guidelines for national health information management professionals? The American Health Information Management Association sets the professional and educational rules for our career field. They host the registry exams, and they help workers stay updated on modern record-keeping practices. Welcome back to our study program, where we are learning these important health topics together. I am very proud of you for returning to study with me for another great lesson. We are going to make this journey simple, and you will learn everything without feeling stressed. Your dedication is wonderful, and I know you will pass this registry exam with flying colors. Let us focus our minds. Take a deep breath, and continue preparing for your successful future. Section 2 will teach you about patient privacy, data security, and keeping hospital records totally safe. We must understand federal laws like HIPAA, which strictly control how we share personal medical information. You need to know when doctors can release private files, and when they must say no. Hospitals use strong computer passwords, locked doors, and secure servers to protect patient trust every day. Learning these security rules will help you answer many questions on your upcoming registry certification test. We are also going to look at different safeguards that prevent hackers from stealing medical records. You must remember that every patient has the right to keep their personal health information private. Please subscribe to my channel right now, so you never miss out on future learning videos. You should also check the description below to find the complete course and offline app link. We are ready to begin. So let us practice answering our next group of test questions. 20. What federal law protects the privacy and security of a patient's personal health information? The HIPAA privacy rule is the federal law that keeps medical records safe and totally secure. This law prevents hospitals from sharing sensitive data without getting clear permission from the patient first. 21. What do we call information that can identify a specific patient in a medical record? Protected health information includes names, birth dates, and social security numbers linked to medical care. Healthcare workers must keep this specific data safe and never share it with unauthorized outside people. 22. What principle says we should only access the exact information needed to do our jobs? The minimum necessary rule tells workers to only view the data required to finish their tasks. A billing clerk only needs payment details, so they should not read the full surgery report. 23. Can a hospital share a patient's medical record for treatment purposes without their written permission? Yes. Hospitals can freely share medical files with other doctors to provide proper patient treatment. The law allows sharing for treatment, payment, and daily operations without getting a signed consent form. 24. What document tells patients exactly how a hospital will use and protect their medical data? The Notice of Privacy Practices explains how the clinic will handle and protect personal health records. Every patient must receive this important document during their very first visit to the medical facility. 25. Who has the right to request a complete copy of a personal medical record file? The adult patient or their legal representative has the right to request copies of their records. The hospital must provide these copies within 30 days. But they can charge a small fee. 26. What type of security safeguard includes locking office doors and using security cameras in hospitals? Physical safeguards are security measures that protect the actual building and computer equipment from outside theft. Locking file cabinets and restricting access to server rooms are great examples of these physical protections. 27. What do we call a security breach where hackers lock computers and demand money payments? Ransomware is a dangerous virus that locks hospital computers until the administration pays a large fee. Hackers use this software to steal data, which causes terrible disruptions to normal patient care services. 28. What type of security measure requires employees to use special passwords to enter the computer? Technical safeguards use software controls like strong passwords to keep unauthorized users out of the system. Firewalls and data encryption are also important technical tools that protect records from online internet hackers. 29. What administrative rule requires hospitals to train their staff about proper health data privacy laws? Administrative safeguards are facility rules that require training, policies, and security planning for all hospital workers. Managers must create clear guidelines, so every employee knows exactly how to handle private medical data. 30. What happens if a hospital worker looks at the medical record of a famous celebrity? That worker commits a serious privacy violation, and the hospital will likely fire them very quickly. Snooping through files without a valid work reason breaks federal laws and carries very heavy penalties. 31. What process removes patient names and dates from a medical record for safe scientific research? De-identification removes all personal details from a record, making it completely impossible to identify the patient. Researchers use this safe data to study diseases, and it does not violate any privacy laws. 32. When must a hospital report a major data breach that affects many different patient records? Hospitals must report any large breach to the government within 60 days of discovering the problem. If the breach affects more than 500 people, the local news media must be notified. 33. Which federal office is responsible for investigating HIPAA privacy complaints and punishing medical security violations? The Office for Civil Rights investigates privacy complaints and hands out heavy fines to careless hospitals. This government agency enforces the laws, ensuring that all health facilities protect patient rights very strictly. 34. Can a patient ask the doctor to fix a mistake in their official medical chart? Yes. Patients have the legal right to request an amendment to their personal health record document. The doctor can review the request and add a correction note if the patient is right. 35. What document gives a hospital permission to release medical records to a specific outside lawyer? An authorization form is a legal document signed by the patient to release data outside hospitals. This form must clearly state exactly what information is going to be sent to the lawyer. 36. What security tool scrambles text messages so hackers cannot read them during internet data transfers? Encryption is a technical security tool that scrambles readable text into a secret and hidden code. Even if hackers steal the data, they cannot read the files without the special decryption key. 37. What type of log keeps track of every single person who looks at a computer chart? An audit trail is a computer tracking system that records exactly who opened a patient file. Managers check these logs regularly to make sure employees are not viewing files without good reasons. 38. Can a teenager's medical record about drug treatment be shared with their parents without permission? No. Special state laws usually protect sensitive teenage treatments from being shared without their direct consent. Rules about mental health, drug abuse, and pregnancy require extra privacy care for young teenage patients. Welcome back to our great study course, where we learn together and build your bright future. I am so happy you returned, because your hard work will bring you amazing success soon. We will explore more topics, helping you feel totally prepared for the big certification exam ahead. Section 3 covers medical coding, hospital billing, and how insurance companies pay for patient health care. You will learn about code books, which translate doctor notes into simple numbers for insurance claims. Knowing these payment cycles helps hospitals stay open, so they can treat sick patients every day. We are going to practice new questions, checking your knowledge about these important hospital money rules. Please subscribe to my channel right now, so you never miss our next helpful study videos. Check the description below to find the complete course and the offline study app link easily. 39. What system do hospitals use to code diagnoses for patients staying inside the medical care facility? Hospitals use the ICD system to code the main diagnosis for every single inpatient staying overnight. This coding system tracks diseases, and it helps the government understand community health problems very clearly. 40. Which coding manual do doctors always use to report outpatient procedures and minor clinic surgery services? Doctors use the Captain Coding Book to report all the medical procedures they perform on patients. These specific codes tell the insurance company exactly what physical work the doctor did during visits. 41. What do we call the process of changing medical text words into specific billing number codes? Medical coding is the careful process of translating written doctor notes into standard alphanumeric tracking numbers. Professional coders read the chart, find the correct numbers, and send them for hospital billing claims. 42. What is the main term used when an insurance company pays a hospital for medical services? Reimbursement is the official money payment that hospitals receive for treating sick or injured local patients. Facilities need this steady payment cycle to pay nurses, buy supplies, and keep the lights on. 43. Which busy hospital department sends the final medical bills to the large health insurance company networks? The Patient Financial Services Department sends out the final billing claims to collect needed hospital money. They carefully check the medical codes, add the costs, and submit the forms for quick payment. 44. What happens if a medical coder accidentally types the wrong diagnosis number on a billing claim? The insurance company will usually deny the claim, and the hospital will not get paid quickly. Accuracy is highly important, because coding errors cause huge money delays for the whole medical facility. 45. What form do hospitals use to send billing claims for patients who stayed overnight for care? Hospitals use the standard UB04 claim form to bill health insurance for inpatient room and board. This special form holds all the facility charges, diagnosis codes, and dates of the hospital stay. 46. Which payment system groups similar hospital cases together to decide the final payment amount in advance? The prospective payment system sets the exact payment rate before the patient even leaves the hospital. Medicare uses this system to control costs, grouping similar sicknesses into standard payment groups for fairness. 47. What is the name of the official group that manages the Medicare and Medicaid government programs? The Centers for Medicare and Medicaid Services manages these large public health insurance programs for citizens. This government agency creates many strict rules, and hospitals must follow them to receive federal money. 48. What do we call it when a hospital charges more money than the doctor actually earned? Upcoding is an illegal practice where facilities report higher codes to get more insurance money unfairly. This is a form of fraud, and it can cause terrible legal trouble for the organization. 49. What is the specific name of the coding book used for medical supplies and ambulance rides? The HCPCS Level 2 codebook is used to bill for medical equipment and ambulance transport. It covers extra items outside of standard doctor procedures, like wheelchairs, bandages, and special walking crutches. 50. What term describes the list of every service and item a hospital charges to a patient? The chargemaster is a large electronic database that lists the price for every single hospital service. It automatically adds the correct fee to the patient account when nurses scan supplies or medicines.